Today's August 21st, 2018. We're here with Victoria, who has serious problems in her knees. This knee had a joint replacement, and you can see that it's enlarged, inflamed, and that knee is bone on bone, and she's got significant swelling in her legs. And she's here for one reason only, and that's to get ozone in her knees. And we don't have to do any more than that. But I'd like to see you get up off the chair and walk to the door, please. Okay, you can come back to the chair. That's good. And thank you. And my purpose in this, in videoing it, is we want to have a before and after, and I would like to be able to post this on YouTube if that's okay with you.
Okay.
Thank you very much. And none of you have any issues with that either. Is that correct? Okay.
Not what she does.
Thank you.
Yep.
Okay. And this leg doesn't get past 90 degrees and you have a lot of pain. And I can't straighten it out either. That's not fully 180 degrees. And this knee goes a little bit more than 90, just barely, but you're in pain. We can see that in her face. And it also doesn't totally straighten. Okay, you can turn it off. Okay, we'll have you get up.
Well, definitely easier.
Let's see you walk to the door. I think she's walking better.
Yeah,
You are.
she is,
Definitely.
How does it feel?
Yeah, it feels better.
It feels better?
A lot better. Yeah.
I'm so
Yeah.
excited.
Okay.
Oh my gosh.
Now, do both knees feel better?
Both of them.
Both feel
Yes.
better.
Yes.
And for the viewer, because this is going up on YouTube, we did one knee, this knee, which is your real knee, bone on bone, and your left knee has a prosthesis, and we did that too. And that had pain because there's inflammation inside the joint space. And I did explain to you there's a higher risk of infection because of the prosthesis,
Yes.
but I still don't expect an infection. And but the ozone can reduce the inflammation. That's the goal. How much pain is left? If you came in with 10 points of pain, how much pain was left in there?
Oh, hardly nothing.
Hardly
In
nothing.
fact, I
Go-
don't think there's even
Watch her get up. Watch her get up.
Kidding?
Look at that. Is that amazing?
Gosh, that is so amazing.
Yep, did it for me too.
Yeah,
You're pleased.
I'm pleased.
Thank you very much for
Thank you.
coming in.
Okay.
Today's date is August 21st. This is Dr. Dan, who is a chiropractor, and we just did your mother.
Correct.
And you're pleased with those results.
Absolutely.
But you're also here, you have a story to tell about yourself and your own knees, right?
Right.
What happened and when?
About 2 years ago, I'm bone on my left knee, and they wanted to do a knee replacement, which I did not want to do. And so I started researching, found out about Dr. Rowan, and came down and had amazing results. Right after the first, I couldn't bend my knee at all, and I probably had an 80% improvement. Well, this was a year and a half ago. I'm getting one today too, just for a little insurance. But
You had about 80% improvement
right.
from one injection.
From one injection, and then I was telling Mom about 2 hours later, I had a little bit of increased pain, maybe about 1% increased. So it was very, very slight increase in pain. I came back for 2 more injections, and man, I've been doing everything. You know, I'm not jogging because it's not good for
That's
my knee.
not good for you.
Yeah,
No.
yeah, but I'm doing everything. Shouldn't be working on my knees at home on projects, but I do, and
And you had bone on bone and you couldn't do that before?
I couldn't do that before. No,
Okay.
no, and I'm doing
So that's good
really,
long-term
really good.
relief from one session.
Long-term
Just a couple.
relief.
You actually had a few sessions.
Yeah, and honestly, the reason I'm getting injected today is because I'm here, just for a little insurance.
Got it.
And
I would do the same.
I've been beating it to death lately, and I thought, I'm
My
gonna get it.
God, you're beating it to death. You're functioning. Your last injections were a couple years ago, and everything is really good.
Correct.
Jumping off of the swing.
I love it. Thank you. I may
Yeah,
post this.
thank you. Yes, you can.
Thank you very much. Jumping off the swings. Wow. Today's date is 8/21. I have a whole family here today, and this is Anne, who is the
The oldest.
aunt of Dan
And the oldest
and the
sister.
sister of Victoria, and you're the oldest, and you're here for me to do your knee. So let's see what you can do. Can you get off of here and walk to the door?
Okay, let me, I've been sitting too long. Oh,
Do you need a cane?
yes. Well, I'm gonna-
Use your cane. That's fine.
Right now, because I've gotten nothing. I usually don't have any trouble.
Okay, and come back. And one more time, go back to the door. Okay, are you able to sit down on that chair?
Yes.
Let's see. And get up from the chair, please. Okay, very good, thank you, and I have your permission to video you and post you on YouTube?
Yes.
Thank you. Range of motion of your knee, and it's not totally flat, but it's pretty close. And it's a little bit better than 90 degrees. Okay, very good, and we can stop that. Well, we just did your knee, so I'm going to ask you to get up and walk, and come to me, and walk to the door.
She's working better. Holy smokes.
She seems to be faster.
Yeah.
She's fast anyways.
I,
Look at this, no cane.
nice. How you doing, Tita?
I'm good.
Good.
Do you have, is there a decrease in pain?
No. Yeah, there's no pain.
There's no pain,
No pain.
and you're walking really good.
I'm working great.
Okay, so you're a happy camper too,
I
right?
am.
Okay. All right. I told you that, and I want the viewer to know this too. Pain can come back. Usually, when I get a result this good, only a little bit of pain comes back if it does come back. This is a really good result. If it does, we just do you again.
Okay.
And your nephew, we had to do him a few times.
3 times.
Three times, and one knee is 100% better,
Mm-hmm.
and the other knee is close to that, isn't it?
Yeah, well, I have bone on bone, so
Yeah.
you know.
Bone on bone, but you're functioning. You're
Oh.
playing with kids. You're throwing your.
Jumping off swings.
I'm jumping off swings.
You're jumping off swings,
with my
right?
grandkids. Yeah, oh, yeah.
All right. Well,
Doing everything.
and you have your own knee, right?
Yeah.
Okay. Thank you. So, thank you for coming in. It's an honor that you all would come in, and
you.
I just want you to keep walking. And I also told you both, please keep your weight down.
I know.
Every additional pound in your belly is trauma, heavy trauma to your knees.
Okay.
All right?
I'm gonna stop going to their house and eating.
You can go to their house and just eat the right stuff.
Okay.
All right?
All right.